You know, x-rays and CAT scans and PET scans are amazing devices because you can see what you could not previously see. But sometimes you don't like the look of it. Hi, I'm Scott Ott with Bill Whittle and Stephen Green. This episode of Right Angle brought to you by the members at BillWhittle.com. And gentlemen, the Wall Street Journal did a little bit of actual journalism and started probing into the pricing at major hospitals and minor hospitals across the country to see if they could figure out what people were actually paying for healthcare. And one of the results of this study, and let me just give you a little snapshot of it, an example out of a hospital in Danville, Kentucky. You go into that hospital, you get a stent procedure where they put a stent in your heart or wherever that goes around your heart. And if you're on Medicare, you pay $12,445, or actually your fellow Americans pay $12,445 for it. If you have insurance, they gave the example of Anthem Health Insurance Company, that same stent is going to cost $17,895 for the people at Anthem. However, if you're not insured, the cash price for a $12,000 or $18,000 stent is $66,626. And what they found is routinely across the country, uninsured people were paying much higher rates, sometimes 3.6 times higher than a Medicare patient would pay for the same procedure. Now, hospitals were mandated to implement price transparency during the Trump administration. Many still have not, but from the ones that do, what they're finding is this startling data, Bill Whittle, that essentially says that the people who can least afford it are paying the highest prices. And to top that off, 11 years after the passage of the Patient Protection and Affordable Care Act, familiarly known as Obamacare, there are still 29 million Americans who are uninsured. So this is a significant challenge. Bill, is this just capitalism charging, the cash patients who come in there or the uninsured patients more because they're not getting the group discounts that an insurance company or Medicare would get?
This is the opposite of capitalism. This is the worst of both possible worlds. When you get into this relationship between the state and the private sector, basically giving each other tongue baths, you generally can call that mercantilism, and it is not only worse than free market economies, it's also worse than completely state-run economies. It genuinely is the worst of both worlds. You could make a case that if you had a purely single-payer system like they had in the Soviet Union, everybody got universally crappy health care, but the universally crappy health care was somewhat affordable in terms of what it cost society. This situation that we have now has no bearing whatsoever to any form of logic or reality of any kind, not even political logic, which is itself an oxymoron. If I were to try to fix the healthcare system, I think I could do it pretty quickly. I would insist on increased regulation and increased vigilance in one area only. I'd cut regulations everywhere, except for I would look very closely at the quality of care coming from individual doctors, because a significant number of the malpractice cases and so on come from a relatively, in fact, remarkably small number of people. I'd go after those people hard. And then I'd let everything else go. And the reason is very simple, right? The reason that healthcare costs what it costs now is because when I was a boy, if I went to the doctor, I sprained my ankle, I'd go to the doctor's office, I'd sit on the table, I'd show him my swollen ankle, he'd move it around a little bit, I'd go, ow. He'd say, you have a swollen ankle, Bill. Stay off it for a while and bathe it in Epsom salts. That'll be $35. And now I go in or a kid my age goes in and he does the exact same thing, moves it around. He says, Erasmus, you got a swollen ankle. You got a sprained ankle. But I'm going to have to give you an MRI to be sure. Because if I don't give you an MRI and it turns out that you fall or something gets worse, then attorneys are going to come after me for not having offered this test. And so therefore, instead of $35, it's going to be $3,500. And when an aspirin that costs 2 cents when you buy it at Walmart in a jar of 100, they'll charge you $20 for that on the insurance company thing. So we've been through all this before, but look, there's nothing about this that has anything to do with the free market. And my car has far more options than I do, far more. My car gets to decide how much insurance it wants to carry. My car gets to decide what the deductible is going to be. My car gets to decide what the rate is going to be. My car gets to decide any number of things that I, as a human being, don't have an option to decide on, because auto insurance is not regulated like health insurance is. And now we get to the point. What we have is not really insurance. My auto insurance does not cover oil changes, and my auto insurance does not cover a ding in the car that big. But that's how the healthcare insurance system works. If I've got a cough or I feel a little feverish, I go to the doctor and it all goes on the insurance. So the doctor has a standing army of people who do nothing but pay for the regulations from Washington, the regulations for the health insurance company, and all of it. Actual genuine insurance, if you wanted to make this a sane system, would be what's called stop-loss insurance. And instead of having to pay thousands and thousands of dollars a month, you'd only pay a couple $100s a month. And what you would be paying for is, if something catastrophic happens to you, you get a diagnosis of some very serious disease like cancer, or you get hit by a bus, then this insurance kicks in to pay the doctors market value, and that's how you protect yourself against catastrophe. But no, it's got nothing to do with the market, Scott. Nothing. And when you've got a system that is this screwed up, you really just have to say, is it just built this way? It's not. Auto insurance is a one-to-one perfect analogy of how you could solve the healthcare system in this country. Auto insurance gets to compete across state lines. Auto insurance has any number of options. You get to pick what you want and how much risk you want to take. Ever since FDR tried to, we're not going to spend all day on this, but when FDR decides to lock down prices and set prices, companies can no longer compete for employees because they can't offer them a raise, because the government says you simply are not allowed by law to pay a good person more. So how do you get a good person? Well, let's offer them to pay their health care. And then the health care gets tied to the employer, and everything downstream of this is a result of this satanic deal between the government and free enterprise and the unwillingness to let prices set themselves. And the only way to solve this is to go at this like Alexander did and just basically chop the thing open. And the one thing you were talking about with transparency of prices was, if they did a look at this 7-8 years ago, where if you had carpal tunnel syndrome and you put it through your insurance, the hospital was going to charge your insurance company $13,000 for that procedure. But if you came in with cash, came in ready to write a check, they would charge you something like $1,390, because that's what it actually cost. And until we get to the heart of this, we're never going to get this solved. And it's not going to be something that can happen incrementally. It's going to have to be an absolute reset.
Now, Stephen Green, not many hospitals are willing to stand up and just say, hey, we're just getting such a high volume of customers from Medicare and from the insurance companies that, of course, we're going to cut them a special price that we can't give to the average uninsured person or cash customer because it's volume. And so they're not coming out and saying that, but the Wall Street Journal is. They do say, the hospitals say, that we have aid programs. One hospital chain, Tenet, said that they can reduce their uninsured patients' bills by up to 85%, but the Wall Street Journal found that in practice, the aid program actually, for the majority of customers, reduced it only by 20 or 30% off the nominal, top rate. The real excuse that you could make if you wanted to, Steve, is that hospitals know that from uninsured patients, what they charge them, they're likely only going to collect about 5% of that after dunning them for a year and then writing off that expense. But insured patients who have copays and deductibles and out-of-pocket expenses that have to be paid in cash are much better customers in that sense. They can collect up to 40% of that amount of money. And so, Steve, they're just saying, well, they're not saying this, but the evidence seems to be saying this, that, well, we can't recoup most of that money from uninsured people anyway, so we might as well jack up the prices. But I'm asking you, wouldn't a capitalist solution to that be better to say, we know we're only going to collect 5% of this money, so why don't we charge much lower prices and maybe get the money right away?
Well, bad money chases out good. You can't get capitalism into a system that is, as Bill said, essentially mercantilist. It's like trying to play a softball game during a Major League Baseball game. They don't go. You can't squeeze these two things into the same space. That they don't fit. And the thing you have to remember is they are talking about, even if it's tacitly talking about volume. Volume increases size. Size decreases transparency, and this is where a major part of our cost comes from. Medicine used to be much more mom and pop. There weren't hospital chains. There was a hospital. And once the insurance companies and big government get involved, and it's all about volume, then you have your mom and pop doctor is no longer mom and pop. They work for a clinic that's owned by a major corporation that has clinics all over town or all over the state or all over the country. Same thing with hospitals. It's about volume. Now you've got big money and you've got your local hospital is now a huge chain, and transparency goes out the window. Everything is so incredibly opaque. I give a real world example. This happened to me. I had Graves' disease. My thyroid was extremely naughty. I can't remember what the numbers are anymore because frankly, it didn't concern me. I just wanted to get healthier. But my thyroid was producing 8.5 times the maximum safe level of thyroid hormone. I was eating 4,000 calories a day and I weighed 116 pounds. It was killing me. My body was eating itself. And the traditional treatment for this is you would go into your endocrinologist, and once your thyroid reached a certain level, and mine was way above that certain level, they go into their lead line safe and they get out their dose of radioactive iodine. It's a little gray capsule. And you take that and you avoid hugging small children for a few days. You don't sleep in the same bed with your wife. And over the course of the next few weeks, that iodine collects in your hyperactive thyroid and the radiation kills the tissue and no more thyroid. You take Synthroid for the rest of your life. And this is not what I did, because that procedure was very quick and cost a few $100 and was done by your local mom or pop endocrinologist. Now, the first thing I had to do was lie completely still for, I think it was an hour or an hour and a half on this very uncomfortable table after drinking some sort of barium type solution, just a mild radiation thing, so that this device could move very slowly over the course of an hour or hour and a half, whatever it was, getting a radiation measurement of the size of my thyroid so they'd know exactly how much of the radioactive iodine to give me. And then instead of my doctor pulling the pill out of a safe, I go to the hospital. And actually, this is really funny. You remember the scene in Ghostbusters when they turn on their radioactive the devices on their backpacks in the elevator for the first time, and everybody just kind of takes a step back from the guy who switched his on. They take the lid off the radioactive iodine pill, and everybody just kind of steps back from this tiny little stainless steel pill case. But anyway, you pop the pill, same as you would have done, and then you go through what you go through. But that's now a $8,000 procedure that takes days instead of a $400 procedure that you do at your local doctor's office. So that's just one real world example that I've lived through. And what it reminds me of is Douglas Adams in one of the Hitchhiker's Guide to the Galaxy books talked about bistro math, where if you're at a restaurant, the numbers are all awful. And it's an entire field of mathematics. The numbers are impossible to know. I'll just give you the quick rundown here. It says the first non-absolute number is the number of people for whom the table is reserved. This will vary during the course of the first 3 telephone calls to the restaurant. The second non-absolute number is the given time of arrival. And, various people arriving late, early, whatever. Nobody actually arrives at the time of the reservation. And the third and most mysterious piece of non-absoluteness of all lies in the relationship between the number of items on the check, the cost of each item, the number of people at the table, and what they are each prepared to pay for. And it goes on in that vein. And the reason it's so funny is if you've ever tried to settle the check at a large party at a restaurant, you know what a pain in the ass that is. And it is 2 + 2 = 4 compared to what hospitals and insurance companies and Medicare get away with.
Yeah, if you want to start a wave of concern at your local hospital, simply ask the doctor what the recommended procedure is going to cost. I actually did that once. My wife was in there and I'm not going to go into details of the medical condition, but they said they had to do a scope. And I said, okay, what's the scope cost? Because they had said there are 2 ways of doing it. They could do black and white or color. And I wanted to know what the variable of the cost was and what the effectiveness of each one was. And the doctor and nurse just looked at me like I had a spider on my head and said, you'll have to call our billing office. And so I called the billing office and heard that there was, it took me a while to get this, by the way, a huge gap between the cost of the basic black and white scope and the color scope, and that the color scope helped them to see some reddish tinge in an ulcerated piece of tissue a little bit better than the black and white one did. And the doctor acknowledged that there, wasn't a huge difference, but of course there was a difference. And, implying what kind of husband am I if I don't want to go the full Monty and pay for the color scope. And so you can't not do that. If they had to present that up front and said, okay, here are your two choices. We can either do this black and white scope for $500 or we can do the color scope for $5,000. Here are the differences and this is what it's worth. That would have been an entirely different business. In fact, that would have been entirely like most every other business that I go to. I work in a retail environment. I can't hide the cost of the sofa. I'm not allowed to go, well, I really can't tell you what this Flex Steel sofa goes for. Just trust me, it's a better sofa than that Ashley sofa. But, you want to know how much they cost? Oh, you'll have to call our billing office to find out the Ashley sofa's $300 and the Flex Steel sofa's $1,200. And, I have to show them the price and I have to explain the benefits and drawbacks and features of each of the products. And I just think that if you're going to talk about transparency and claim this special privilege among all industries that you are doing important work that saves people's lives, well, then why does the Wall Street Journal have to unearth this information? If you're going to go and you're going to stick a tube in my abdomen and inflate me like a beach ball so that you can fix my hernia, I think that we have the kind of relationship that's not going to be shattered if you tell me how much the stuff actually costs up front. For Bill Whittle and Stephen Green, I'm Scott Ott. Thanks to the members at BillWhittle.com for making Right Angle possible.